Hello and welcome. You watching Global Lens on News9 Live with me, Neha Khanna. Our big focus on the show today is on COVID-19 and China, the country where the virus originated. It is a country that is notorious for its lack of transparency on all matters. Now, from the beginning of the COVID pandemic that originated in Wuhan, China has brazenly concealed from the world and its own people critical information about the origins of the virus, the dangers and massive spread of the disease, both within its borders and outside, and essentially the gravity of the entire situation that unleashed the worst pandemic of this century. A pandemic that wreaked havoc across the world, took over 7 million lives, destroyed millions of other people, wiped out entire families, devastated whole countries, and ravished economies. China has consistently lied to the world and to its own people. Little wonder then that China has now gone ahead and deleted its COVID death data. According to a report published in UK-based Financial Times, Zhejiang, one of the most populous provinces in China, has deleted the mortality data that indicated the high death toll caused by Beijing's abrupt relaxation of its COVID regulations at the end of last year. The newspaper has referred to the statistics that were released by Zhejiang province last Thursday, which showed that the number of cremations in this wealthy coastal region during the first quarter of 2023 jumped a whopping 73% compared to a year earlier. The number had been pegged at 171,000, much higher than the 99,000 and 91,000 deaths reported during the same period in 2022 and 2021, respectively. When this data created a flutter on the Chinese social media, Zhejiang province decided to delete the numbers altogether 4 days later. Like we said, right since the beginning of COVID-19, experts have repeatedly called out Beijing for its dubious statistics on the pandemic. The first known case was reported in China towards the end of 2019, and when it started to spread, it was declared a public health emergency of international concern in January 2020. Countries around the world were always skeptical about the data coming from China, as concerns were raised over the transparency and accuracy of information about COVID's origin, the number of deaths in that country, and a lot more. For 3 years, China resorted to extremely stringent COVID measures that were in fact draconian in nature in an attempt to curb the spread of the deadly virus. But in December 2022, when the country suddenly revised its pandemic policy, hospitals and crematoriums were inundated with COVID patients. But Chinese officials have refused to reveal accurate statistics that would allow experts to properly estimate the impact of the virus's spread across the population. No less than the World Health Organization has accused China of grossly underrepresenting the severity of its coronavirus outbreak and the real number of deaths, an allegation that China continues to deny. Fact is, China has not released any reliable COVID data till date, and whatever numbers are available in the public domain are highly questionable. As if that's not bad enough, just recently in an interview, a researcher at the Wuhan Institute of Virology made an astounding claim. Chao said coronavirus was engineered by China as a bioweapon and that his colleagues were given 4 strains of the virus to find out which one could spread best. The question is simply this: isn't it time the world held China accountable for the COVID pandemic and demanded some answers? All right, let's go across to our panel of experts. We are joined at this point by Dr. Ranga Reddy, President of the Infection Control Academy of India. We're also hoping to be joined in a moment by Dr. Dheeraj Kaul, a clinical researcher and data analyst in New York, whose work has largely been focused on COVID in the last 3 years. All right, Dr. Ranga Reddy, good evening. Let me start with you. Like I said, for 3 years now, China has been anything but transparent about coronavirus. The world is still wondering how the virus originated and spread all over, killing more than 7 million people. No matter how hard you try, no answers seem to be forthcoming from Beijing. What are your thoughts on the latest revelation that's been made by the Financial Times in this report that says that China has deleted its own COVID death data because the numbers were thought to be alarmingly high, and China, being China, simply does not want to be subjected to any kind of scrutiny, not by the world and not by its own people?
Thank you very much for having me on your show. Yes, this debate probably would continue for decades to come on who is the perpetrator of COVID-19, which had been the health emergency of this particular century. China, all the fingers are shown at Beijing by both the World Health Organization and also the civil society organizations and the governments for their lack of transparency. From the beginning of this pandemic, China always had been in a hide and seek mode, where it was not forthcoming very clearly on the origins, the cause of whatever has happened in Wuhan, and at the same time they are also forthcoming with the data. That is what is the accusation which is made by many organizations across the world. And there seemed to be some truth and also some credence to all those accusations made by a whole spectrum of organizations, from the country leaderships to the civil society players. Now, coming to this particular instance, where after the declaration of the pandemic to be over, still fudging the data, I can't fathom what could be reason behind it. Unless the countries are going to come very clearly, very transparently with the data, that is going to be a biggest obstacle for the pandemic preparedness and ensuring that, whenever we are going to encounter yet another pandemic, what kind of actions to be taken and what we can do in order to not only respond, but also prevent and prepare for the future pandemics. So if the news which is being published by the UK-based Financial Times is right, then certainly the countries and also the United Nations and the World Health Organization had to come very strongly on China in order to ensure that they are going to come out with all the truth, so that that truth can be the basis in order to make the future decisions.
Well, you're right, but I will stick my neck out and say the unfortunate reality seems to be that even the World Health Organization has failed to come down strongly enough on China in the last 3 years, and clearly the international community has failed to hold China accountable. Let me now go across to Dr. Dheeraj Kaul, who joins us from Miami in the US. Dr. Kaul, as I mentioned at the start of the show, the Zhejiang province in China published some data last Thursday which showed that the deaths that had been caused in China on account of COVID in the first quarter of 2023 saw a 73% jump compared to 2022 and 2021. We are looking at a figure of somewhere around 171,000 deaths. As soon as these figures created a flutter on the Chinese social media, the government of Zhejiang province decides to delete this data. We all know that in December last year, hospitals and crematoriums across China were overflowing after the country abruptly relaxed its stringent COVID rules. And now, the World Health Organization is accusing China of grossly underrepresenting the severity of its coronavirus outbreak and the real number of deaths. My question to you is, would you agree that China clearly does not feel that it is accountable to the world for a pandemic that it, in a sense, unleashed on the world? Secondly, when we do not have enough information available about China's COVID outbreak and the mortality rate, doesn't it impact the overall study of the pandemic and the virus itself?
Thank you so much for having me on the show. I think this is an amazing and very well put out question, what you're raising. Actually, we have been raising this concern. So I was attached with COVID data research from January 2020, when people started hearing about it, till all the way till this year, April. And we've been following the data from different countries coming. And you're absolutely true. There are 4 points to your question. Number one, the basis of fighting with COVID is to sharing data across boundaries, across governments, could be socialist, democratically elected, dictatorial, or communist. It doesn't matter. It's human race. So we had to share the data to help science evolve. But the data coming out of China was always spectacle. There were questions that they are lowering the mortality, lowering the hospitalization rate. The numbers you're mentioning, I have seen that report, 174,000. Matter of fact, we anticipate the COVID numbers, which were dropped down by China, were anything between 80 to 120% lower than what was shown. I'm talking about mortality and ICU admission rates. Data coming out of China, you have to take it with a pinch of salt, because the government really monitors it very closely. And China, if you know, the efficacy of Chinese vaccine was also under question. So the question would arise after getting fully vaccinated. China, matter of fact, claims to have fully vaccinated at the fastest rate. But then the efficacy of that vaccine was under question and jeopardy, that how come people who are fully vaccinated are dying from COVID? How come people who are fully vaccinated are getting ICUs, intubated? If you look at the number of lung transplants done, so I work at a transplant center, the lung transplant has been picked up after COVID and damages. In China, the number of lung transplant has also drastically gone up to such a limit that they don't have enough manpower, enough trained physicians, ICU critical care people to manage lung transplant. Like I'm in a program where we manage lung transplant patient every day. Matter of fact, saw 5 of them today. So the point I'm trying to raise is, unless we share information, we cannot find COVID or the new variant of COVID, which may evolve, or any other bug. And this is causing real concerns at the galleries of WHO, international organizations who follow data, who trigger pandemics, who trigger epidemics. Because you have to understand, before pandemic, you have a stage of epidemic. And if there is a delay in reporting, it can mess up a lot of things for a lot of people. And that's exactly what happened with COVID. We were not alerted in September. Now, new studies are showing, new data points are showing that COVID prevalence in China had picked up in September, October, November 2019, not January or December 2019, now what we are talking about. So the timing is the key. You have to be a step ahead of the virus, which is the hardest thing to do. But when you share the data, when you share the number, we know the trajectory in which the virus is going. When you tell us what kind of vaccine you are using, when you tell us what antibiotics you are using, antivirals you are using, what steroids you are using. We manage COVID, I have seen hundreds and hundreds of COVID patients. I have seen many patients who have multi-organ transplant, immunosuppressed, and we are managing these challenged patients. But our data is public. In US, any hospital, you can go, you can figure out the COVID numbers, even today, as of hour to hour. So transparency of data is very big, and this will affect the fight against COVID. We all are fighting, and we are still fighting. COVID is not over. There's mortality from COVID. There are people who are hospitalized. There are people who are losing their lungs to COVID and requiring transplant. So it's an ongoing battle, and you are absolutely right. It's a very concerning point that why would you fudge numbers and hide the data from international community?
Well, you've put it very well. Dr. Ranga Reddy, Dr. Dheeraj Kaul is obviously right in pointing out that when China continues to lie to the world, continues to fudge such critical data, what it is essentially doing is obstructing the global fight against the pandemic. COVID, we know, is not not over yet. If we are to fully contain the spread of the virus, we are to ensure that newer, more dangerous, more lethal variants of the virus do not do not form, then at the very least, what you need is data from every part of the world. Now, even going back to the genesis of the pandemic, to how it all began, we're not even at the moment talking about how it started in Wuhan, how coronavirus jumped species from animals to human beings, from bats to human beings, and whether there is a possibility that it leaked from the Wuhan lab of virology. Keeping all those unanswered questions aside, one fact that is indisputable is that COVID had started spreading in China as early as October, November 2019. And the first time that the rest of the world actually heard about it was in late January. China hid this from the world for at least 2 months. Had we known earlier, had we known in November or December of 2019 that there was this virus in our midst and it was spreading like wildfire, perhaps many more lives could have been lost. This is on China, isn't it?
Absolutely. I think we are in an interconnected world. We cannot be oblivious to somebody's actions like what China is doing in terms of hiding the data, hiding actually the origins, and also hiding from the public whatever is needed in order to take the preventive steps. I think that is not only immoral, but even it is criminal, because had you have very rightly mentioned that we have lost a very valuable time to respond, that is from probably October 2019 till January 2020. If China could come forth with the information early, probably the world could have responded better and reduced the number of deaths and also the casualties which we have seen towards COVID-19. That is one aspect of it. It is related to the COVID-19. But COVID-19, unfortunately, would not be the last pandemic what we are going to see probably even in our lifetime. Although we dub it as a pandemic of the century, but there is no guarantee that these kind of pandemics are going to occur in much more shorter periodicity than what we have seen. That means the world had to remain vigilant. The world had to have a very transparent sharing of the information on whatever is happening in their respective countries. The early signals had to be very well analyzed. That means, the data had to be the right data given at the right time, based on which, the analysis had to be done and preventive actions and response actions had to be taken. So coming next 10 years, probably we will have equally big pandemic coming up. That is why the G20, which is currently presided by India, is taking all the efforts in order to bring the pandemic prevention, preparedness, and response kind of modality and the framework. Taking that into consideration, if the China is going to go in the way how it has behaved during the COVID-19, the world cannot actually have the safety and cannot have, the kind of response measures and preventive measures to deal with the future pandemics.
That is, again, a very, very important point. Dr. Dheeraj Kaul, as frightening as this sounds, Dr. Reddy makes an important point that while we keep referring to COVID as the pandemic of the century, there is no guarantee that there will not be another pandemic in our lifetimes, no less than the World Health Organization has said so. And as both of you have pointed out, if we have to unitedly fight such viruses in the future, if we have to unitedly prepare for such future pandemics, then everyone has got to be on board. Every country has got to play its role. China is still, if not the most populous, at least the second most populous country in the world. The question then is, how do you hold a country like this accountable? Because China does not feel the need to offer any answers, to give any explanations, to share any data, to share any critical information. And as I keep saying, that this is a pandemic that was in many ways unleashed on us, unleashed on the world by China. And yet China feels it's absolutely all right for it to remain tight-lipped and not share any information, not give any answers. How do you hold a country like that accountable?
That's a million dollar question, actually. Believe it or not, like, being in data, I could totally tell you the amount of mortality we went through. And don't forget, countries which were not prepared, countries which are high populations with low infrastructure, including India, the devastation which countries like that were affected, like Brazil, South Africa, that could have been much less if we had the data coming in January instead of, say, April, when the world started taking COVID seriously. And that data existed. It was hidden so that there is no business disconnection from China, supply chain disruption doesn't go. There is economical studies into it. What was the reason of hiding it? What would have affected in September versus December? So the business and trade, which is coming of China, would have been affected. There would be panic in the country. There would be lockdowns. There would be disruption. But then you have to look into, are you looking into saving $1 trillion, $500 billion versus millions of lives which would be saved? As a physician, we value human life to the highest esteem, and we do our best. We train for decades and decades to try to save a single human life. If we can save many, that's a blessing. But when you start looking at countries and organizations which hide critical data, which is going to affect their citizens also, by the way, not only their innocent citizens, but people around, because virus has no boundaries, no countries. It will cross. It's a matter of time. And not only that, if you recall, the air travel from China was continued till February and April. They didn't do any lockdown of traveling out. They were stopping people from coming in. And that's how it went to Europe also. And Europe had no idea what was going on. In Italy, in Holland, you know what devastation it went through. So it's not only about the timing, whether you're not letting the data know so that we are getting prepared. You are actively aiding in spreading infection because you didn't even stop your own travel. On top of that, you did not share the genomic sequence till February or March of 2020 under the pressure of UN and WHO when you were. If we had a genomic sequence, say in September, because I'm in the data and I was following the companies very closely, so we could have come up with vaccination way earlier. A 3 or 4 months advance development of a vaccine, you're looking into millions of lives saved. Vaccines work, we all know this. So who's accountable for the extra amount of people's life lost? Who's accountable for loved ones which were lost, loss of job, loss of employment, loss of businesses
economies
across the world?
Ravaged, families wiped out, over 7 million lives lost.
And
who's
and
answerable?
let me tell you something.
Yes.
Let me tell you something. If you had COVID, there is such a thing called long COVID, mental
Absolutely.
fog. People have their lungs affected. I see this every single day. I'm a
Yes.
transplant physician. I see this every single day. Just because you recovered from COVID doesn't mean there is no scarring. You have 1 or 2 pneumonias and then you go down the drain, intubated ICU, and then we are sending you for lung transplant. It's a very big challenge.
So
One cost
many
of lung
lives
transplant
have
is
been changed
$600,000.
irreversibly around the globe.
Correct.
The question I want to ask you, Dr. Kaul, before I go back to Dr. Reddy, even though it may sound a little strange, given how China, is known for its opacity over everything, Everything in that country is shrouded in mystery. But I would still like to ask you, out of curiosity, what do you think is the reason why China has chosen to be so opaque about COVID? Forget about the origins, because that would open a whole Pandora's box altogether. But even when it comes to sharing data about, the number of cases, the number of deaths, the vaccines, why do you think China has acted in the way that it has?
So three reasons. First of all, if you recall, I don't want to go into the depth, but look at the person responsible, the chief scientist of WHO, who helped him nominate. There was a big controversy going on. Number two, if you provide us the data, it's not rocket science to track it back from case zero. Where did it exist? And it took like a year for somebody to even go to Wuhan and start looking into that. By that time, the trace is wiped out. So number one, the issue was they don't want to take the blame that it originated there. That's what they were calling it. We called it Wuhan virus. They said, no, it's not from here. It's from. So this kind of dropping the ball on somebody else's area so that you don't give data. So we are not able to see. We follow data, right? So that's one reason. Second reason is I think they're protecting their financial interests so that the orders, because it's a world's factory, 85 to 90% of products come from China, from a pen to a plastic of the water bottle. So if their workers get panic attack, everything shuts down, their economy goes to knees. That's what they do, produce. So economical. And the third is, don't forget, most of the communist governments are paranoid because they are trying to create a fear that the West hates us. They are trying to put us down. We need to fight. We need to stay united as communists. Nothing against that. But that paranoia of China was clearly seen about not sharing the information. And how many millions and millions of lives were lost? We lost $3.5 trillion in the GDP because of COVID. Matter of fact, the last president is the only leader who actually came on media and said somebody has to pay for the financial losses and the COVID checks we are giving. And how about we look into China's origin? So it was a real issue. But I totally agree with you. There are 3 points. I think they put money over life, which is very sad. They try to, hide things from us just to protect their reputation so that the business is on and not for somebody to find out where it originated. Those were the three big, and I'm attached. I work as a biotech analyst, so I understand the market and finance side of things very well. But one thing I will tell you, even if you go to big banks, big corporates, nobody values money over human life in US. We still value human life and dignity much more. And that's what differs us, a democratic country, from a It's sad to say that, although communism says that we are all equal, but it did not act like that. Tell me one leader of China which passed away from COVID. Tell me one industrialist. One.
Yes. That's a valid question, and that's very well explained. Whether China likes it or not, fact of the matter is that its conduct has been not just highly questionable, but downright condemnable. It's been absolutely despicable. China is singularly responsible for unleashing the pandemic that has wreaked havoc with the entire world. You're right. It is about their paranoia. It is about their secrecy. It is about their international image, and their priority being money over everything else, including
Absolutely.
human life. I think I have to agree with you there 100%. Dr. Reddy, I can't help but bring this matter up. For 3 years now, the world has been asking the most fundamental question: how did coronavirus spread? How did it come into existence? Why did so many people have to die? The debate on the origin or the genesis of the virus has gone on for well over 3 years now. The World Health Organization has said that its probe into the origins of the virus has been inconclusive, because it is well established by now that China has not cooperated with that investigation. China has simply not given international scientists, WHO scientists, the access that they needed, especially to Wuhan, and which was the epicenter and ground zero, and to the Wuhan Institute of Virology. Questions will continue to be asked about whether it was a lab leak. In fact, I'm going to quote a man called Chao Shao to you. He recently gave an interview. Who is Chao Shao? He was a researcher at the Wuhan Institute of Virology. He made an astounding claim in a recent interview saying coronavirus was engineered by China as a bioweapon and that his colleagues were given 4 strains of the virus to find out which one could spread best. Now, I am not suggesting for a moment that I endorse this theory. Of course, there is no evidence to prove this theory. You could call it a wild conspiracy theory. But fact of the matter is that there are way too many questions and simply no answers have been forthcoming from Beijing.
Absolutely. I think, you are right. In an autocratic country, either it is China or any other autocratic country, the delegation of the power is very poor. And hence, the whole system gets frozen whenever an emergency situation like COVID happens. There is nobody to take a decision and follow the protocol which otherwise is followed by the system. Either it is politicians or the administrators or the bureaucrats or the people on the ground. They get frozen because they don't know, how to go about it. They always look up to, the General Secretary of the Communist Party in order to get an indication whether to open the mouth or not. So that is the very reason why the information was not coming, in a way how it had to flow as per all the international kind of accords which are already in place, either through World Health Organization, United Nations, or other agreements which are already prevailing. They actually force every country to share the information, but an autocratic country, they don't actually give much respect to such agreements, and hence actually the information is not coming out. As with any instance, including the Twin Tower collapse, the World Trade Center collapse in US, whenever there is a big event like that happens, or big catastrophe, or a big kind of problem happens, there are always, conspiracy theories. And we will hear, many in the decades to come, not in the even years, but even in decades to come. Probably we will never be able to go down and find the actual reason and actual origin of the COVID-19 unless the world is going to be united and demand from China the kind of information what is required to analyze and find out the reasons behind the COVID-19 origin. So unless we are going to do that, the world is going to remain vulnerable to the new viruses, new bacteria, whether they are man-made or naturally occurring. It is a question, which is always going to remain a question.
Absolutely.
And you and me and our families and our communities are always going to be vulnerable, and always actually keep the fingers crossed, thinking that nothing should happen.
Absolutely correct, but who's going to tell that to China? Dr. Dheeraj Kaul, as we wrap up this discussion, I want to ask you a couple of quick questions. One, what are your thoughts on the various theories that we've heard in the last 3+ years about the possible origins or genesis of coronavirus, including the one that says it may have been a leak from a lab? And how often in human history have we witnessed a virus jumping species, transferring from animals to human beings, as it happened in this case?
I think those are very smart questions. Matter of fact, we did a show here for local media on origins of COVID. Now, the biggest curtain on all this mystic thing happening right now is the data transparency, coming back to square one. The data coming out of China to look at the numbers, to look at the origin, what they are giving is genomic sequencing of the first one, but that's not the first patient. That's really not the first patient. And they're talking about pangolin species. jumping of species from one to another to a third, it does happen, but it's not a common event. It's a very rare event, like plague happened and common cold right after World War One. But then when you look and you put circumstantial evidence, you look at the genomic sequencing of the first patient, the COVID one, which we had, you will see traits of different human viruses, not animal viruses, but human viruses. That's number one. So the theory of lab leak or lab manufactured virus, which countries do, and they do it at level 4 labs, which is in Wuhan of China, one of the most advanced. And there was information that the researchers were trained in Canada and they flew back to look at gene editing, gene amplification, and natural selection, if you know what that is. So that means you can take a virus and you can basically go at time travel speed, at a very high speed, and the multiplication and the exchange of genetic information between viruses to modify, to survive in that trait. 100,000 years can be squeezed in like weeks. 1,000,000 years can be squeezed in months. That's the technology which exists right now. It's a very cutting edge technology which can be very deadly for human race and be very beneficial to develop vaccines. Why do we use it? Because suppose we are sitting in India or some country and we feel there's a new virus in birds, for example, a new bird flu, and we can get infected in it in case 20 or 30 change to the genomic sequencing happens. But it's very close, maybe 10, maybe 200 years down the road, 300 years down the road. So big countries have fund for it. They start working and develop a vaccine beforehand, before that jump species happen. That's why the natural selection and this amplification of timing of genomics editing happens. And that's a good technique. But from this lab, if you are working on a vaccine and you have a virus prototype, and if that virus prototype gets leaked, you can have thing out of control. So that's theory number one for lab leak. Theory number two is, was it a controlled test which went rogue, out of control? They thought we will be able to, because before you spread any virus, you have a vaccine ready. So there is a theory, hypothesis, that people around the lab, people at big places managing it were vaccinated, army guys. And then there was a controlled trial in the area to see how it spread, and it went out of control, away from their expectations. So that's the second thing, which is intentional. So being developed as a bioweapon. So that's what the hypothesis is. But I want to give it the benefit of doubt. I would say lab leak is where the fingers are pointed out. Jump species, what China is proclaiming, but we don't have definitive data to make that conclusion, because we are people of data. I will not speak anything against data, but I must tell you, there is too many coincidences which are falling in line to make you feel that it seems like it's a man-edited virus. I won't say man-created, but man-edited virus. They are pointing. Now, why would a man-edited virus cause pandemic or epidemic unless it's accidentally leaked or intentionally? I don't want to even think somebody is capable to do such thing as a physician.
I know what you mean. I know what you mean. But fact of the matter is that because of the mystery surrounding it, these questions are bound to be asked. And forgive me for saying this, but I don't remember, a single member of the Chinese leadership ever getting COVID.
Exactly. That's my point. So what does that mean? That means if you are, suppose you have an army general, a brigadier of the area, he's vaccinated, his lieutenants are vaccinated. Do you see any mortalities happening there? Nothing.
Absolutely.
It's a mystery.
It's a mystery even as ordinary Chinese and people around the world continue to lose their lives. So the biggest question really is, will we ever know the complete truth about COVID and its origins? Will China ever be held accountable? Doesn't the international community need to do a lot more, mount much more pressure on Beijing and hold it accountable for what is clearly the pandemic of this century? On that note, Dr. Ranga Reddy and Dr. Dheeraj Kaul, thank you so much for joining us and sharing your perspective with us on that big story emanating from China this week.
Thank you.
All right, time for us to take a quick break here on Global Lens, but don't go anywhere. We have lots more lined up for you on the other side.
Pakistan is actually genociding Baloch people. So being Baloch is a crime. If you are a Baloch, it means in the eyes of Pakistan, you don't have any right to live.
The Chinese and Pakistanis are colonizing the Baloch and exploiting their resources.
The Baloch